Hi there, I'm Stuart Mays from Construction Health and Wellbeing. I'm just taking this opportunity to share a health, safety and wellbeing moment with you. It's a live case which is around work-related stress, and as it's Mental Health Awareness Week, I thought it'd be quite apt to share this with you. So this is an ongoing case where the HSE have fined and sent a notification of contravention to the University of Birmingham for failing to properly manage work-related stress. This is the letter that's actually sent to them. And we're going to look at this in a little bit more detail. The HSE identified several significant failings in the university's approach to managing stress. Firstly, although there was a stress management policy in place, it had not been fully implemented in practice. Second failing, the second failing that the HSE found is that the organisational stress risk management did not adequately identify the key psychosocial risks or control the measures needed to prevent these risks. The HSE also concluded that the controls already in place were insufficient to reduce the likelihood of employees experiencing work-related stress. And finally, they found there was no effective monitoring or a review process to check whether controls were working or remained suitable over time. And what we're finding here is that this case demonstrates that having policies and procedures is not enough. Organisations must actively implement, monitor, and review their arrangements for managing psychosocial risks. So we're going to look at a video, and this is some advice that the HSE have given. This is a video which HSE released last month, April 2026, and this highlights what they expect when they visit.
Hi, I'm Jenny Skelton from HSE. I'm a Principal Inspector in Inspection Division, where we spend our days visiting sites from small businesses to large multi-site organisations, assessing how they manage risks to protect workers' health. In some cases, work-related stress. I'm going to explain today what to expect if HSE inspects your organisation on work-related stress. During an inspection, we use HSE Management Standards approach. This focuses on 6 key areas that can contribute to work-related stress if not managed correctly. They are demands, control, support, relationship, role and change. We also look at how organisations are managing stress overall using a plan, do, check, act approach. As part of inspection, we may review documents including stress policies, stress risk assessments, and also staff surveys. In addition, we'll be looking at occupational health data and sickness absence data. We will also speak to managers, employees, and where appropriate, trade union representatives to understand how the risk is being managed in practice. Leadership is key. Senior leaderships need to be proactive, visible in their commitment, and involve employees in developing solutions. A helpful way to do this is by putting the 5 R's into practice. Reach out, start conversations, and create a supportive culture. Recognise, spot the signs of stress, train managers, and share information. Respond, act on the risks, assess individuals, provide support. Reflect, learn lessons, make it routine, regularly check in, and have wellbeing conversations. By understanding the risks and taking practical action, organisations can prevent work related stress, protect workers' health, and support productive workplaces.
Thank you, Jenny. And as the video was playing, some of the important aspects of that came up there on the text. We will look at the 5 R's in the next slide, but I think here we can safely say that the message from the HSE is clear. Work-related stress should be managed with the same level of structure and rigour as any other health and safety risk. So speaking of the 5 R's and how to manage, we'll look at these in a little bit more detail. So reach out. This is where you can engage with your workforce through meaningful consultation and conversations to understand their concerns. Here we can look at using the 35 question stress indicator tool that the HSC have. Recognize. Here we're looking at identifying psychosocial risks and understand the risks that may be impacting employees. We then need to look at responding to those risks. Okay, so we're implementing practical control measures and interventions to reduce stresses and support well-being. We then need to reflect on these, and this is looking at reviewing what the controls we have in place. Are they being effective? And are we monitoring the outcomes and gathering feedback? And finally, routine emphasizes that stress management is not a one off exercise. It requires ongoing monitoring, reviewing, and continual improvement. And when we look at these 5 R's, what Jenny is describing there is a stress risk assessment, looking at plan, do, check, act, which is that health and safety management cycle which she mentioned. Importantly, this is not what the University of Birmingham were doing. They failed to do that. They did not effectively implement, review, or monitor their arrangements. So the HSC kindly sent them some advice and some feedback as to what they should do. This is taken verbatim from the letter. And as it says there, to comply with the above regulations, what they're looking to do is the HSE instructed the organisation to review its management arrangements to ensure it fully understands the extent of work-related stress within the organisation. This included improving how stress-related data was managed and analyzed. Sorry, how stress-related data was collected and analysed. They're also required to review the stress management policy to ensure it is both suitable and properly implemented in practice. Another key requirement was to review and strengthen their organisational stress risk assessments, ensuring that controls were suitable and sufficient to manage the identified risks. The HSE also directed the university to carry out more focused risk assessments within specific departments. They also particularly suggested they look at the demands, control, and support, which are which are three of the key management standard areas, as we saw earlier. And finally, the organisation was told to establish a robust monitoring and review arrangements to ensure controls remained effective over time. And a major occurring theme throughout this process was that the HSE fed back that employee consultation and involvement was key. And this gives us a final thought for this moment, which is that how would your organization measure up to this? Do we meet these expectations? And what our recommendations would be here is that you look at reviewing our current procedure and are we to confirm compliance? Are we compliant with our current processes and procedures? We certainly need to look to ensure that senior leadership understand both the risk and the responsibility associated with work-related stress. And we'd look at recommending holding a workshop to identify how we move forward. I think the key takeaway from this is that psychosocial risk management is now a significant regulatory focus area, and organizations must be able to demonstrate active leadership, consultation, risk assessment, and continual review.